Hey guys, this is Stephanie not calling, but on the show right now. This is the last interview for the Low Carb USA conference, and this is the most awaited.
Thank you.
I have posted this on Friday, and that's the one that people wanted the most. So
Thank you.
what we're going to do, as we've done for all the other interviews, is I'm going to ask 5 or 6 questions that are mainly oriented to what I hear all the time in social media and from you in the groups. And then we're going to allow the ladies to ask their own question to you. So we're going to see the question popping up
okay.
here.
Terrific.
Okay? So, as I explained to you before we got on live, my audience is mainly female. And I have been teaching paleo low carb. And recently, probably in the last year, I've started to advise people to do intermittent fasting, which is what Jason's work is all about, right? So if you have read Obesity Code, which is your most recent book.
Yeah.
And now you have the upcoming book with Jimmy Moore, which is Complete Guide.
Complete Guide to Fasting.
Excellent. We've already got some heart going for you there. And I've been advising people to do the principle that you've been teaching, which is intermittent fasting. I have not gone to the point of teaching people about long fasts yet.
Right.
And I know that's what you're using therapeutically for you with your patients,
only
right?
for very severe cases. So many of the less severe cases, then we just use shorter fasts.
Okay. And what do you describe as a shorter fast in your world?
So I usually break them by the 24-hour mark. So
Okay.
24-hour fast would mean to go from, say, dinner. If you eat dinner on Monday, then you don't eat anything after dinner, and then breakfast and lunch you skip, and then you eat dinner again. So you're still actually eating every day. You're not going a full day without eating, but at the same time that dinner to dinner period, or lunch to lunch, or breakfast to breakfast, whatever you prefer, is a 24-hour period. So it really just means skipping breakfast and lunch for the most part.
Yeah.
So that's something that is provides a lot of benefits without being very difficult to fit into lots of people's lives. So the extended fasts, which are longer than 24 hours, are a little bit more intrusive, and we use them for more severe medical conditions where it's much more important to get quick results before people get sick, right?
Yeah.
But for most people, doing a 24-hour fast is not a big deal because you're still eating every day. You can take, if you're taking medications, if you're taking pills or multivitamins and you need to take it with food, you can. So it makes it easier. It's just skipping breakfast and lunch. And honestly, who hasn't done that once in a while, right? You get busy at work, you skip breakfast, you skip lunch, and that's it, right? It's just that it's okay and you do it consciously so that you can derive the benefits from that.
And it's much easier and you have better compliance as well, right?
Yeah, and really the most important thing is actually to find something that fits into your life. So if that fits into your life well, then great. If it doesn't and you don't like it and you want to do something different, then do that, right? Because everybody knows if you do something and it's really hard and you just dread it every time it comes up, you won't be doing it for very long. So there's no point even considering that, right? Because it's not something that you can keep up with. So if it's something that becomes routine, I mean, obviously the first couple of weeks are always going to be very, very difficult because your body's not used to it, you're not used to it. But once you get into the kind of routine, then it becomes almost like second nature.
Very easy to do. Yeah. So what I heard you say is that the longer fasts are more what we call therapeutic. So for people with more severe cases, right?
Yeah. So I treat a lot of type 2 diabetes, a lot of people with obesity-related health problems, so fatty liver, and these are severe medical conditions, right? And you can get very sick if you don't treat that condition. So those call for more kind of extreme measures.
Severe.
If you will. So it's like it's stronger dose, it's more powerful, but it's harder and it requires a bit more supervision.
Perfect. So what I hear you say, you would advise more the 24-hour fast for the type of ladies that I have on the show today.
Yeah, those are fairly easy. You can extend that if you're ambitious to a 36-hour, which is a full day. So that's if you eat dinner on Monday, say you skip breakfast, lunch, and dinner, and then don't eat again until Wednesday morning. So that's longer than 24 hours. It's a 36-hour fast. But yet at the same time, it's almost 50% longer. So you get more benefits. But at the same time, some people will like that, and some people won't, and whatever you like is really what you want to do. But you can do that fairly easily if you're not have medical conditions, if you don't have like medications. If you have medications, for example, then you do have to talk to a physician, because especially for blood sugar medications, type 2 diabetes medications, you have to make sure that somebody is monitoring you, that you don't go too low or too
Very
high.
important.
Yeah, very important.
Okay. So what are those benefits you're talking about? So what is the benefit of a 24, 36-hour fast?
Well, there's lots of benefits, and mostly they're metabolic benefits. So weight loss is what many people are looking for.
Yes.
And obviously, if you don't eat for a period of time, you're going to lose weight.
Yeah.
Right? And that's the whole thing. The other thing that I deal with quite a lot is type 2 diabetes, pre-diabetes, insulin resistance, that sort of idea. And again, that if you don't eat, your blood sugars will go down, right? So then you don't have to take medications to bring it down. So, for instance, if you have a person who is kind of on the borderline and their doctor is saying, well, you should take medications, and you don't want to take medications, well, look, if you don't eat, your blood sugar will come down. Then you don't need to take that medication, right? Now, if you are on medications, you really have to talk to somebody about monitoring that. But on the other hand, it gives you an option to do something yourself. And the point is that it's a natural solution. Right? You're not taking medications, you're not doing surgery, you're not doing some kind of weird thing. It's natural, you're letting your body clean itself out of all the sugar, and at the same time, it's giving you all the same benefits that, of blood sugar lowering, for example, that those medications would give you, but you're not going to take it for the rest of your life, right?
Yes.
And that's the idea. It gives people options to use. They can use it or they cannot use it. But if nobody ever gives you the option, then you will never use it, right? And I think that's what's important here, is that fasting, for example, and low carbohydrate diets and ketogenic diets, they are all options that are reasonable. They've been used for many, many years. And in some cases, they are very effective. Why wouldn't you use it, right? If it's not effective, then sure, go do something else. Right, exactly.
Move along.
But if they are effective, then you should use them, right? And everybody's different, right? So some people will do very well, and some people won't do very well. And everybody's different, and if you never have that option, you'll never find that group of people who do very well and respond very well and have tremendous benefits, because those are real benefits, right? You can't deny that. So, it's about giving people options to use.
So the ladies are very well aware of insulin resistance. So could we say that intermittent fasting, in the way you're teaching it, is a way of repairing insulin resistance?
Well, absolutely. So insulin resistance is where your body doesn't respond to the insulin as well. And this is a phenomenon we see all the time in physiology, human physiology. That is, if you stimulate something all the time, it becomes less responsive, right? So, and this happens all the time, right? So, for example, if you were to yell at your kids, right, to clean up their room, it's great the first time. The second time, the third time, you yell at them every couple hours to clean up the room. Oh, they're tuning you out like there's no tomorrow, right? It's the same thing, right? They've lost that sensitivity to you, right? And that's what happens to the body. If your insulin level is high all the time, insulin's screaming at your body all the time, day in, day out, all day, insulin's screaming at you, you tune it out. And that's insulin resistance, right? Mm-hmm. So if you all of a sudden tune it down for a while, you'll regain that sensitivity. And then that will go away. And insulin resistance, as many people know, is really the base, the core problem of many of our health issues, right? Yes. So the high cholesterol, high blood pressure, the metabolic syndrome, type 2 diabetes, which then leads to heart attacks, strokes, cancer. So it really is a core problem of the whole thing. And that's why these sort of fasts were used to be called cleanses and detoxes, and they'd be like a couple of days or a week. And the idea is to get your insulin level really low, reset your insulin sensitivity, and then go from there. Right?
Yeah.
And people used to do this regularly, like every couple months, every once a year, whatever it is. And we've lost that. Nobody does it anymore. You say the word, and everybody thinks you're like
crazy.
Exactly.
It's because we have food available to us all the time. People see fasting as starvation instead of seeing it as a clinical tool. Even still, religion to this day will use fasting.
Absolutely, and it's something that people have recognized all over the world that is deeply and intrinsically purifying and cleansing and healing. Right? So the idea is not to starve. Starvation is different from fasting.
Thank
right?
you. Yeah.
So starvation is when you don't eat, but you have no control about when you're going to eat. So if you think about starving children in Africa, they don't know when they're going to eat again. They are truly starving, right? The physiology is similar, but fasting means you can do it or you can stop. If you don't feel well, you feel really bad about it, then you stop. Right? You have complete control over it. So it's more like the way that people do the cleanse and detoxes, where you decide, for whatever reason, not to eat and let your body repair itself. And the amazing part is that our body has the ability to do that. We just have to let it, right? But we never do. We don't let it. We get people who tell you to eat all the time, even if you're not hungry. Eat. It's breakfast time, and you have to eat even if you're not hungry.
Because the watch says it.
Exactly, right? So instead of listening to our bodies, we've lost that ability, and we just say, oh, it's 12 o'clock, I must eat. Right? It's like, but you don't have to. It's not necessary, right? Because your body is able to burn down some of that sugar, burn down some of the fat, instead of putting more food in your mouth. It will burn it. And that's all that fat is stored food energy, right? So it's there for you to use when you don't have anything to eat. If you never not have anything to eat, then you won't burn the fat. It stays there because your body says, why am I going to burn that? I'll just burn the hamburger you just ate, right? So then it stays there because, again, it's a survival mechanism. The body doesn't want to use the stores if it has stuff freely available, right?
Now, another thing that I hear you say is it's going to allow us to burn our reserve, right? And allow us to tap in our reserve to fuel our body. So people going into fasting for the first time, is it easier to do from a state of low-carb ketogenic diet, or people that are coming from the North American standard diet going into fasting? What would be your recommendation at that level?
It's often much easier. So our experience is that it's much easier for people from a low-carb or ketogenic diet because their bodies are already very adapted to burning fat. And if you're used to burning carbohydrates or sugar, then all of a sudden your body is now forced to use fat because that's the storage form of our food energy, and it doesn't really know how. It hasn't been used in a while, so it's harder, right? So you get more hunger, people get more cravings, and it's just harder. So yes, absolutely, it would be easier to do from a low-carb ketogenic environment diet, for sure.
So one typical issue that I see because I deal mainly with women, I see women going into 18 to 24 hours intermittent fasting and having negative side effect. I would say about 20 to 25%. And it's mainly surrounding sleep disturbance, anxiety, and binging. They have this incredible hunger to eat after fasting. Have you observed the same thing, and how do you deal with that?
Yeah, and it's not limited to women. Men get
same thing?
All the same problems. So there's a few problems that always come up. So binging is one of them. You will eat more when you start to eat again. So you just want to make sure that you eat a low carbohydrate diet. And the best advice is to pretend like you haven't fasted. Like pretend like you have eaten. Lunch, for example, you ate lunch, but it's a lunch of your own fats, right? And that's really what you have to think about. So try to avoid it. These things do get easier as you do it more because your body is able to kind of switch back and forth. And what people say a lot is that they just can't eat the same amount that they used to. Their hunger, everybody assumes that their hunger will get more and more, but as they start fasting, they actually notice hunger goes down and down. So if you're less hungry, and perfect. Right? You're eating till you're full and you're eating less because you're able to access those fat stores, then that's perfect. That's like what we want to see. What was the other thing that they said?
Sleep disturbance is a big one.
Sleep disturbances is a big one. Men get that too. So when you fast, there's counter-regulatory hormones. One of them is noradrenaline, which is gives you energy. So cortisol does go up slightly as well. So the whole thing is that a lot of the problem is that people have a certain pattern of sleep,
Yeah.
and if your body is pumping you full of adrenaline, you're not going to be able to sleep.
Yeah,
I don't have a great solution for that, other than I tell people to not, if you're not sleepy, then don't try to sleep. The last thing you want to do is lay in bed like for 3 hours of each awake.
Spinning.
You can go do something. You can read a book. You can go for a walk. You can do something else. Do some work.
Yeah.
Watch a movie. Whatever it is you want to do. And then when you are tired, to go to sleep. And then try to maintain, because other people say, oh, then I can't go to sleep, and then I wake up late or something. Maintain the same hour of waking, right? So if you normally wake up at 7 o'clock, then wake up at 7 o'clock. Yes, you only got 4 hours of sleep that night. But it's okay because your body didn't need it. That's what it's telling you. Your body's telling you don't need to sleep right now because it's, giving you all this energy. So it is a problem. I'll grant you that.
Yeah.
But you have to try.
Does it get better with time though? Or the body get accustomed to this hormonal level?
Yeah, sometimes it doesn't really. So most things do get better. The sleep disturbances is not really it doesn't always get better, but people learn to deal with it more. Like they know that if they're fasting, that they can get a couple extra hours that they don't have to sleep, right? And that's great. There's extra time to do whatever you want to do, right? Whether it's go on the internet, do some sewing, talk to friends, whatever it is they want to do, they have some extra time to do it. So I think it's actually a tremendous thing. Because I never have enough hours in the day, right?
Who has?
It's great. I mean, and don't waste it, right? It's like, why go to sleep if you're not sleepy, right? So I try and say, well, I know this happens, but try and turn that to your advantage and make the best of it. But if it becomes too problematic, maybe the fasting isn't something that you should do.
At this point in time in your life. Maybe you
shorter fast or something that
not as frequent.
Yeah, exactly. So you have to see how you respond, because everybody responds differently, and you can't say that what works for you is going to work for me, right? You're going to respond completely differently to the same thing, and you're going to find something that works for you. But there's infinite flexibility. Like you can do more, you can do less, you can do longer, you can do shorter. You can add some things back into the fasting period, like fat and stuff. There's variations of fasting, and so many different ways to do it, and so on. So yeah, it doesn't mean just because one way doesn't work doesn't mean it's like all
bad.
It's all bad. Yeah.
So anxiety would come from the same place. Elevated level of cortisol in the body would drive up the anxiety.
Yes. So it's the same idea. And if it is a real problem, then it may not be the appropriate solution for you. But we've treated a lot of people with fasting, and there are very few that we've had to stop for that
completely.
Reason. Yeah, you do have to give it a couple of weeks because your body does take a bit of time to adjust. And it's like exercise. If you do it the first time, it's difficult, and then it gets easier and easier and easier. And fasting is all the same because you're using this sort of mechanism that your body isn't used to using.
Yeah.
So that's all it is.
So I know for myself, I fasted for the first time 2.5 or 3 years ago. That's when in the paleo world, the intermittent fasting came to life, and I had a real hard time doing it because at that point I had elevated level of cortisol naturally in my body, and then that just accentuated it. Where now I can do it without absolutely a problem because I've healed that part of myself.
Right.
So it can totally be you. Now I hear you talk about the flexibility into fasting. So are you suggesting a pattern into which people will fast, or is it more going as their body is telling them they should be fasting?
We typically individualize it. I mean, there's some guidelines, right? I mean, obviously, if you go longer, you get better results, right?
Yeah.
So if you fast for 36 hours, it's better than 24, which is better than 16. But how you respond to it, like, headaches are common, constipation.
Yeah.
And some people are very distressed by things, and other people are not bothered at all. So there's no real right answer.
Cool.
You can do whatever suits you. The number one rule we have, really, is to fit it into your life. And that's really the most important thing. And then you have to tweak it. Like, say you do shorter fast, like 16-hour fast is what you really find easy. Then yes, you may have to do more of them, right? Because obviously a 16-hour fast is less powerful than a 36-hour fast. So you maybe have to do 2 instead of 1. And somebody else will say, no, I don't like that at all. I like the long fast. And we have people who come back and say, I like the 7-day fast. So I do that once a month, right? So we, don't feel like you have to do one or the other. We will make suggestions. You have to give it some time as well. That's the key, is to make sure you have some time for your body to adapt.
In your book, because I read your book, Obesity Code, and you have 2 protocol. I think you have a complete chapter on guiding people through different formula with fasting, right?
Yeah.
So, dealing again with female, any recommendation regarding post-pregnancy weight loss and breastfeeding? Is there any concern at that point?
Absolutely. So pregnancy and breastfeeding, we don't recommend any kind of fasting, especially not more than 24 hours, for example. So like if you skip breakfast, like who hasn't done that?
Yeah.
Right? And that may be a 16-hour fast technically, but people do it all the time, right?
Naturally.
Exactly. Or you get busy and you forget breakfast and lunch, and before you know it, it's a 24-hour fast. So people have done it for many reasons, but to do it deliberately for pregnancy and breastfeeding, the reason that we don't recommend it at all is because there are consequences if you become malnourished. So the nutrient demands on your body are much higher, right? So you have to make sure that you stay nourished. Fasting obviously cuts all the calories, but also cuts everything else too.
Yes.
And the consequences are big, because if you are pregnant and you are malnourished, there's consequences to your fetus.
Yeah.
And for breastfeeding, there's consequences to your
baby.
And it's only going to be 9 months for pregnancy, and it's only going to be 4, 6, 9 months for breastfeeding. You can do it later.
Okay.
Right? It's not something that you can never do again. You're going to stop breastfeeding at some point, hopefully, right? Yeah. So
you're going to move on.
Then you got to then do it then, right? Do more of it then. It doesn't matter, right? But it's not that there are a lot of problems. It's that if there is a problem, the consequences are bigger than you really want to take. Like there's too much risk.
I hear you a lot say listen to your body, and you have a very relaxed attitude about this fasting thing. You're not like a person that's by the rule, by the book, and you have to do this every 16 hours and every day. You're teaching people to listen to their body. That's basically what you're doing, right? Yeah.
So what you want to do is you got to listen to your body and see what results you're getting, right? Because if you're not getting the results that you need, then you have to change what you're doing, because it's not going to work, right? So if you change it, try and figure out what you want to change, how you're going to change it, and see, is it something you can do, and are you getting good results, right? And that's the whole point, because if you do a very low carbohydrate diet and it's working great for you, then I wouldn't change anything. I wouldn't add fasting. Why would I add fasting? You're doing great, right? Or if you're doing a very low carbohydrate diet and you're not losing weight, add fasting because you're not doing so well. You've plateaued. You're not losing weight, so don't do the same thing. Do something different. Shake it up, whatever it is. You can do something, and you'll know, because you're going to be able to measure it or feel it, that you're either on the right track or not on the right track. If you're not on the right track, again, change it and see if it works, because what works for everybody is so different. It's like, if you like chocolate and I like vanilla, you're not wrong and I'm not right, and it's just different, right? So you got to listen to your body and look at what the results you want and see which way works for you. And there are people who do things that I don't recommend and are doing well. I still don't change it, right? People do, low-fat diets, high-carbohydrate diets, and if they're losing weight, I don't change them. I say,
that's the goal, to lose weight.
The goal is to lose weight, not to prove yourself right. Right? So be healthy, make sure you're doing well. And if they're doing well on it, I just have no problem with that. Right? If they stop doing well, then they should change it, whatever it is that they have. But if people are eating French fries and pizza and doing well, then you can continue. I don't really have that kind of
attitude.
Attitude. If it's good for you, then good. Just good on you.
And that's what we're teaching to women that have lost in those years of forcing themselves into a diet and trying to lose weight. They've disconnected from their body.
Yeah, absolutely.
And the approach that I like, what you teach with fasting, it is not a regimented approach. You don't have to do it every 2 days for 24 hours and then it's 16
Absolutely.
hours.
It's a guideline, right? So you can do more this week and less next week. Or if you're on vacation with your family,
take a break.
then don't do it, right?
And I heard you say that often.
Exactly. But if you don't do it, you know that you should probably make up for it later on. Otherwise, again, you'll know because your pants are a little too tight, right? You'll know. And then you can do a bit more of it or a bit less of it, whatever you want. But there's nothing that fixes you in there. It's intermittent, because I don't actually believe that diets should be a constant, because life is not constant.
Okay. Yeah.
So if there are going to be times that you will eat more, right? If it's Thanksgiving or if it's
You're
Christmas,
feasting.
then you're feasting. And you got to make up for it, right? With some fasting. And that's the way life is. It's feast and fast. So diets have to be intermittent too, because you know that there's going to be a time where you want to go out and it's your best friend's wedding and you want to have a good time, right? Go have a good time, right? Don't say, oh, I'm not going to eat this, and I'm not going to eat this, and I'm not going to eat this, and okay, no, nothing for me. I'm like, okay, well, that's not very, like, it's bad on many other levels, right? Psychologically, and from friendship, and
emotionally,
and emotionally, there's so many things. But you also can't say, okay, every day is a
party time.
Is a party time. It doesn't work that way, right? It's feast and fast, not feast and then go back to regular, right? It doesn't work that way, right? So if you eat a lot, then eat very little next day. So instead of being the same all the time, some days are high, but some days have to be low, right? And that's the balance of it, right? Not every day is exactly the same, because life is not like that, right? And that's one of the things that is more powerful. The fasting allows you to do, is use it intermittently. Like, just because you do twice a week this week doesn't mean you can't do 4 times a week next week or once a week, right? There's nothing stopping you, right? Or, hey, my pants are a bit tight, or I have and I'm sure the Hollywood stars do this all the time. Oh, the Oscars are coming up. I'm going to fast for a week.
Yes.
I'm sure they do that all the time. And, I always say, the joke's on them. They didn't know it was that healthy. It was healthy for them.
It's actually more than just losing weight.
Yeah, and the thing is that when they talk about it.
We're back.
Yeah, and it's shameful, and you're going to promote anorexia and stuff, right? So you have a few people who talk about it, like Beyonce and these cleanses and stuff, right?
Yeah.
But for the most part, people don't talk about it, but I'm positive that 90% of Hollywood does it because it works.
Oh, you probably heard of the master cleanse that's been around for thousands of years, right? People used to do that. Even I practice Buddhism in my spiritual practice, and that's exactly what we do as well.
It's a cleanse, it's a detox, and like I said, I'm sure that when the Oscars come around, that every female star fasts for a lot of time, right? Or because they want to shed the weight. They do it because it's effective, right? And that's why they do it. So if it's effective, great. They don't talk about it because they've been told it's really unhealthy for them, so they don't want to promote that, right? Oh, you're starving yourself. It's like, but luckily for you, it's really, really good for you. Yeah. Right? As long as you don't do it like day after day and become anorexic, right?
And develop another eating disorder, because often people come to this point having an eating disorder, and when they are not reconnected with themselves, they'll fall into this fasting and redevelop another eating disorder.
Yeah, and there's the opposite too, right? Where people feel that they're obligated to eat all the time too, right? And it's not. It's
another
about
eating
freedom,
disorder.
It's about flexibility, right? That's what it is.
So I'm just going to check in to see if we have any question at this point.
No questions yet.
Do you have?
Until they start asking questions, may I ask a question?
Of course.
Which I know the answer to because you explained it so beautifully yesterday in your presentation. But a question that continually comes up is, does a bulletproof coffee or a fatty coffee, does that break a fast if they are fasting?
Yes, so technically anything that you eat or anything with calories does break a fast. But there are many different variations. So we actually don't use a water-only fast in our clinics. We allow cream or coconut oil or whatever. So the pure fat, like butter and bulletproof coffee and MCT oil and coconut oil, they don't have much of an insulin effect, so they preserve much of the benefits of the fasting, but it still gives you calories. So technically, yes, you are breaking the fast, but as I said, I don't really care, right? The important thing is that, are you getting the same results? Because most people get exactly the same results with water only or fat fasting. And same with bone broth, we allow that. And again, yes, it is breaking the fast. There's protein, there's calories. There is, that is not fast, right? If you're a purist. But again, we use it for longer fasts. It helps people do the fasting. It makes it a lot easier for them. And if it does, and they're able to derive most of the benefits of the fast and make it easier for them. So it's not about me being right that you have to fast, right? It's about getting results. So yeah, absolutely. So there's so many different variations, and in the 5-2 diet by Dr. Michael Mosley, he allows up to 500 calories of whatever you want, right? And he still has great results. So there's so many different variations and things you can tweak to make it, your preferred, what works for you.
For your own
way of living.
So if you take coffee with butter, like a bulletproof coffee, and it really helps you fast until dinner time, then do it.
Awesome. Thank you. Okay, we've got some questions. So Erica says, would fasting help lower inflammation? I have a lot of joint pains almost daily, which may be of arthritic origin. I'm 66.
It does help relieve a lot of inflammation. I don't know whether it will relieve that specific one, but for sure, there's a lot of osteoarthritis, which is wear and tear, and obviously nothing is going to help that, right? But there are lots of anecdotes that people have done it and really had a lot less joint pain. Some of it is related to weight loss too. If you're putting less weight on the joints, then you have less, especially the knees and the hips, for example. But there is an anti-inflammatory effect of the fasting, so it is certainly worth a try.
Awesome. Okay, Norma Grace asks, do you recommend exercise during fasting?
Absolutely. You should do everything that you normally do. Remember, during fasting, what you're doing is you're trying to power your body through your own fat. That is, it's as if you ate breakfast and lunch of your own fat. So you should be able to do everything yourself. Like if you normally go to work, go to work. If you normally walk, if you normally run, if you normally do weights, do that.
Yes. Okay, we have Marlene, and she says, why do I rarely lose weight on a 24-hour fast? Is it because I eat too much in my one meal?
It's possible. Remember that the weight loss after fasting is much less than most people think. So if you look at one full day of fasting, 1 pound of fat is roughly 3,500 calories, and many people eat roughly 1,800 calories. So you're talking about half a pound per day of fasting, right? So that's it, right? So if you fast for 24 hours and you lose that half a pound, you can't even notice it on the scale, right? Especially in women who have these problems with weight retention, like water retention,
hormonal
so it
issue,
gets lost in there. Over time, you will notice it, but the weight, when you do alternate daily fasting, like 24 hours, it goes down and up, down and up. It's only when you do it consistently that you'll notice a steady trend. Now, you could do a full, longer fast, and you'll notice some weight loss as well. So, just, again, keep in mind, so if you do 7 days, you can expect 3.5 pounds of weight loss. It is almost always more than that. It is almost always like 6 pounds or 7 pounds. That other 3 pounds is water, right? You lost a lot of water weight, which is good. I think it's, nobody wants to be all bloated, right? But you will regain that water weight when you start to eat. And that doesn't mean it's failed. It's just the way it is, right? So you do 7 days, you're 3.5 pounds, you're 5 pounds down, and then you regain 1.5.
Right.
That's what is expected. That doesn't mean it didn't work. It worked exactly as it was supposed to work.
Yes. And it looks like there's no other questions, but if I could end with one. For someone who's they decide to do an extended fast, what suggestions do you have of how to break that fast? I know prior you said you just eat like it's your next meal, like you've been eating. For an extended fast, what do you suggest?
The longer it is, the more gentle you have to eat.
Okay.
And so you can eat anything you want. Now, some people find certain things harder than others, like nuts, for example. Some people don't like that. But you can eat whatever you normally eat. But what I recommend is, so say you want to have a little salad or you want to have a little stew, have a really small portion. right? So maybe a really small salad, some vegetables, or if you made ground beef or something, like a really small portion, and then wait half an hour, and then have a bit more, and then what people often do, and I'll tell you, it happens almost to every single person who starts, is that when they start eating, they eat like
there's no tomorrow.
Because it's all psychological. You think that you're going to be really, really, really hungry, so you are.
You're not.
So you eat, and then you get a big stomach ache, right? You do it like twice, and you really quickly realize that I shouldn't be doing that.
Yes.
And then that's when people notice their appetites are shrinking, and they all say, "Oh, it's like my stomach is shrinking." It doesn't physically actually shrink very much, but psychologically it has.
Does.
Yes.
As your body is able to tap into the fat stores. So if you're getting calories from your fat, you don't need to take as many calories in, and your body is signaling to you that you don't have to. So, compare this to typical diets where you just reduce calories. People just are hungry all the time, right? Low-fat diets. They're hungry all the time. Now you're fighting it, day after day after day. But here, what you're doing is, during fasting, you are going to have to kind of, exert a bit of willpower. But on the other days, you're less hungry. Now you're working with your body instead of against your body. And in the long term, it's far more successful.
Yes.
And for everybody, we'll take the last question in, but if you read Dr. Fung's book, Obesity Code, you have outstanding graphics in there explaining this whole concept of fridge, and you've used the same in the presentation, and I think that would help everybody understand that concept, right? Where you're accessing your stored food, your freezer, right?
Exactly, and that's what the goal is. That's what we all want to do. It's just, this is an easy way to do it.
Yeah.
Do you have time for one more question?
Of course. Go.
Okay. Norma Grace asks, will your body ever become resistant to fasting? Like it will eventually not have the same benefits as the first few times you tried it?
No, not really. The thing about the fasting is that they've done many studies, and you can see that the weight loss is pretty continuous. Obviously, if you don't eat, your body doesn't go to 0 calorie expenditure, because then you just die, right? And so it has to come up with calories somewhere. If there's plenty of fat, obviously malnourished, underweight people shouldn't be doing this, but for those people who have fat stores, that's where your body is going to pull it from, right? So it has no choice, right? Even if if you have 0 calories coming in, your body still has to have 1,500 calories to keep the lights on, right? The brain and the liver and the heart and everything working. So you got to get it from somewhere, right? So yes, it's essentially as close to a guarantee as you can possibly get. There's no guarantees.
That is so helpful, because old gals like ourselves, which a lot of these gals are, we remember people saying, you have to eat on a continual basis or your metabolism will slow down, you won't burn any fat. So you have debunked so many of the myths that I'm sure a lot of us have held for years.
Ironic is that cutting your calories by 500 calories a day is guaranteed to slow down your metabolism. It's guaranteed. We've done the studies, we know it. And it's not just that we've done the studies. We all know it. We've all done it. Right?
Yes.
We've all done the, cut 500 calories a day, and then you feel cold and tired, and you feel like crap, and you know your metabolism crashing, because on that lower calorie, your weight has going nowhere, which means you're burning less, right? So we all know that happens, right? You don't need a study to prove it to you. We all have
demonstrated,
done it, right? So absolutely, it's a way to kind of change fuel sources. We're not trying to deprive the body. We're trying to change it from burning food to burning fat. That's all we're trying to do.
So could we say, because I get a lot of questions from women, and there's one actually for this week's question. I do a Q&A every week, and one of the questions is, how do I repair my metabolism?
Yeah, so repairing your metabolism is, you can do a extended fast, because what you do is you force your body to have 0 food coming in. You force it to access all of its energy from fat, right? And sometimes it takes a few days for this to happen. But because you're forcing it, the body's like, okay, now I'm accessing pure fat.
I have to survive.
Food. Yeah, I have to survive. And then it's like, well, there's plenty of this stuff, so let's burn it, right? Because it wants to turn up the dial. It wants to keep your liver and your brain working well. So then your metabolism actually can go up. It can go up and it can go down, right? So it's not permanent, but you have to know how to kind of let that energy flow.
Well, thank you very much.
Okay, thank you.
Thank you. If anybody wants to work with you, you're a doctor in Canada, which means you work out at the Scarborough Hospital, I believe, right?
In Toronto.
And do you do any online work?
We have an online dietary program.
Perfect.
So you
Please
can't,
introduce it.
Yeah, so it's called Intensive Dietary Management at www.intensivedietarymanagement.com.
I'll put the link in the show notes after.
Right. And what it is so it's not legal to give medical advice online.
I know, yeah.
But we provide the same dietary advice that